You?
Patrick,
Everybody hear us online okay?
yes.
Yeah, Patrick, this is Lindy. Can you hear me?
Yes.
Okay, perfect.
Okay. Great. Welcome, everyone. This is Boulder County Board of Health regular meeting, April 14th, 2025. It is 5:33. Let's do a quick round of introductions, roll call before we start the meeting. I am Morgan McMillan, Board President. Morgan McMillan, Board President. And I'm echoing. Okay.
If anybody's joined in the room, make sure you've got your microphone muted.
Amber Johnson, board member.
Landry Fagan, board
Lindy
member.
Hinman. Sorry. Lindy Hinman,
Harrison.
board member.
And Brooke Harrison, board.
All right, we got a full board. Thank you, everyone. Okay, item number 1 is public comment. I know we have several folks signed up. I'm going to let you run this, Patrick and Dahlia.
All right, yeah, thank you, everybody. So we'll call your name. We'll put up a 3-minute timer, so please watch the timer. So we don't have to interrupt you as you wrap up. And we're going to start with Brianna Barber. Do we have Brianna online? I do see her. For that.
Thanks, everyone. Hello, Board of Health members. My name is Brianna Barber, and I work in the Boulder County Commissioner's Office. Today, I'm speaking as an elected member of the Boulder County Employees Union Bargaining Committee. Thank you for allowing us to give comment today. I stand alongside my public health colleagues as Boulder County employees demanding our legally protected right to collectively bargain for better working conditions, pay, and benefits. Hopefully, you've seen the email that we sent to you last week. The public should be aware that while you are cutting jobs and facing the loss of federal money, you are also paying thousands of dollars to hire a private attorney to try and stop our bargaining. At your direction, this attorney is trying to stop the collective bargaining of all Boulder County employees in the 16 other departments, including public health in this bargaining unit. This is unacceptable, and this is a massive waste of taxpayer dollars. The fact that you are directing this attorney to file a motion to stop all bargaining activity for all Boulder County employees in our bargaining unit is shameful. The fact that you are claiming that just the process of beginning negotiations would cause irreparable harm to the Board of Health or Boulder County Public Health is a slap in the face of workers who just want to be valued and protected. I cannot understand how bargaining would cause irreparable harm to the Board of Health or Public Health. What is causing irreparable harm is the behavior of public health leadership that has encouraged the strong unionization effort of public health employees. As a member of the community you serve, I do not understand how you can justify going against the democratic will of public health employees and fighting against their state law protected rights to collectively bargain. This legal action is shameful, and it is something that our current president and the oligarchs that are running this country right now are doing while they union bust. They try to stop collective bargaining because it gives workers a voice, checks abuse of power, and makes them equals. I remember the last time we were here in November, you all said that you supported employees' rights to organize, but this legal action directly conflicts with those statements. If you genuinely do agree that Boulder County public health employees should have the right to organize and collectively bargain, then please stop paying an attorney to try and force us all to stop bargaining. I encourage you all to halt the current legal action with simple law and allow us to proceed with bargaining. You are already taking legal action against our union and district court to try and stop the inclusion of Public Health and Housing Authority. Why can you not let the legal action play out in the courts? Why do you also have to hire an additional attorney and try to file a motion to stop all bargaining? Your motion to stop bargaining impacts over 1,000 workers who desperately need protections right now as jobs and funding are under fire, and we see mismanagement in this organization at every level. Please stand with the workers who keep public health running, the workers who serve this community, and those who keep us safe. Act as though you are a Boulder County public health employee and your rights, working conditions, pay, benefits, and life depend on the ability to collectively bargain this agreement. Thank you for your time.
Thank you.
Next, we have Catherine Lehman.
Hi, thanks so much for the opportunity to come and speak with you all. My name is Catherine Lehman, and I work as the Pearl Program Coordinator in the Boulder County Community Services Department. I'm also a proud member of the Boulder County Employees Union, affiliated with the Communications Workers of America. And I'm here today to speak on behalf of myself and other coworkers who are part of the Boulder County workforce. Like so many of my colleagues, I chose to unionize because I believe that all workers, and especially those serving in the public as public servants, deserve a real voice in the decisions that affect our day-to-day work and the communities we serve. Forming a union was a democratic decision. It was a long process that involved thousands of hours of work of highly dedicated people, many of them workers in the Department of Public Health. And we know that our working conditions are directly tied to the kind of services we can provide to the people of Boulder County. Recently, we found out that Boulder County Public Health and the Boulder County Housing Authority have hired an outside legal firm planning to file a motion to stay the entire collective bargaining process for the entire county workforce. And from what we understand, that would be the impact here. I'm deeply disappointed by this turn of events. Continuing to challenge our right to collectively bargain that disrespects the democratic will of workers, and it's also a waste of taxpayer resources, especially now at a time of national uncertainty. Growing attacks on the rights of workers, a federal attack on federally unionized workers. This legal strategy seems to stand directly in conflict with the will of the workers of Boulder County, in particular, the will of the Department of Public Health workers. We are asking the Board of Public Health today not to stand in the way of collective bargaining. We urge you to reconsider this legal approach and instead choose to come to the table in good faith. Our union is ready to work collaboratively, and we're committed to finding solutions that serve both our workforce and our community. Thank you for your time.
Thank you.
Our timer's having some difficulty, so I'll just give you a warning when we get to the 1 minute mark. So next up, Charlotte Benjamin.
Yes, hi, I'm Charlotte Benjamin. I work in Parks and Open Space. I live in Longmont, Colorado, and I'm commenting as a member of the Boulder County Employees Union. I support wholeheartedly the values of Boulder County Board of Health, as I found on your website. It's, the way I searched it was bouldercounty.gov/departments, and Boulder County Public Health is listed as a department of the county and not separate. So my statement is that we can't take good care of others unless we take care of ourselves. And this is where the union is an essential tool to have healthy, happy employees. The vision of public health is to be a socially just and inclusive community where physical and mental health, social well-being, and the environment are valued, supported, and accessible to all. Your mission is to address all conditions, to ensure all people have the opportunity for a healthy life and can provide the essential services to our public. So I just want to state that the union is here to provide, help to the employees, to Boulder County Board of Health, and everyone in public health to be able to achieve the vision and mission as it's stated on your website and the values of Boulder County in general. And I urge you to reconsider the actions that you are considering in your executive session today. Thank you so much.
Thank you.
Next up, we have Alex.
Hi there. Yeah, my last name is quite long and not from here. But I thought
Thank you. I
heard the name.
appreciate that.
Yeah, no problem. You can enough. I thought I heard the name Dahlia. If it's the same Dahlia, hi Dahlia. I'm in CJS now. Good to see you, I suppose. All right, so I will use my comment time now. Good evening, members of the board. My name is Alex Kananov, and I work for Boulder County Community Justice Services, and I'm also a member of BCEU CWA. Before this, I was a data scientist for Boulder County Public Health for 3 years. I was hired during the height of the COVID-19 pandemic. I saw firsthand how devastating a crisis can be for local government, especially when staff are overworked, underpaid, and lacking resources and a lot of basic protections. I was hired using grant funds. And so I was in a highly precarious situation. I first started off as a contractor, then was converted into a full-time employee. Even so, I knew my time was limited. I saw the size of my team downsizing every year, even though we needed the capacity. I was lucky enough to make it till April 30th, 2024, using the ALC 2.1 grant. During the latter part of my tenure, I was involved with my union. I knew that there was nothing I could do to prevent my grant from running out, but I could at least fight for my coworkers. However, I was afraid to be public about union work. When doing one-on-ones and talking to coworkers, they were excited to be part of a union. However, they were afraid to be outwardly pro-union. To be afraid of being pro-union in Boulder County, one of the most democratic counties in Colorado, should border on the absurd. Public health garnered the most authorization cards per capita out of all the departments because they experienced firsthand how detrimental the effects of being understaffed, overworked, and underpaid. And in an organization where a large minority of their coworkers lack basic protections, the numbers clearly show that a vast majority of public health workers want a union. They need one. However, every act you do has a chilling effect. At the end of the day, people need to put food on their table, and they understand all too well when their job could be on the line. The county claims to be neutral, but practically every action taken by the county shows how hostile upper management is to a union that the workers voted for by a supermajority, a union that we, under state law, have the right to form. Yet every action taken demonstrates how hostile upper management is to a union. Now we're talking about procuring another expensive union busting law firm. CDLE already made their determination. Public health and housing is a part of our bargaining unit. All we ask is for you to follow this ruling. This should be the end of the story, but for some ungodly reason, you're still fighting our union. This is not what
30
our
seconds,
coworkers want.
Alex.
This is not what our coworkers want, and this is certainly not what our constituents want. And this type of union busting, I hate to say it, but it's reminiscent of how Trump, Musk, and Doge are gutting public institutions. Even putting up this resistance, it shows. It has, once again, has a chilling effect. Soon enough, in one way or another, they will be working their way down to local government. In some ways, they already have. When this happens, we do not expect you to fight for us, but give us a chance to defend ourselves and protect our
That's
constituents.
time, Alex. Thank you.
Thank you.
Okay, next up, we have, and I should preface this by saying we have two more comments at the meeting, just in case everyone's wondering how much time we're taking. We have two more people who signed up to provide comment at the meeting. We had several written comments only supplied. We had 5 written comments only. So we have 2. Next is Lori Deddick. Hope I got your last name right, Lori.
Yes, you got it. Thank you. Good evening, board members. My name is Laura Deddick, and I work in Public Works for Boulder County. I'm also proud to serve as an alternate on our union bargaining team, a role I took on because I believe in the power of work voice and the importance of the quality in the workplace. Every department contributes to our community well-being, whether it's repairing roads, protecting public health, or supporting housing. We all serve as the same mission. That's why I'm here to urge you to support the inclusion of Public Health and Housing Authority in our union. These employees don't just support the county, they are the county. The Colorado Department of Labor Employment confirmed this in our ruling. Public Health and Housing Authority staff are Boulder County workers and should be part of our bargaining unit. It also comes to our attention that the legal firm representing this department plans to file a motion of stay in bargaining process. From what we understand, this would pause all bargaining while the inclusion in issues is litigated. This is not neutral. It is a delay tactic that undermines workers and disrespects our democratic vote. The county should drop its legal actions, continue to fight fair, democratic decisions, wasting taxpayer dollars, time, and employees' trust. We voted. The decision was clear. Now it's time to move forward. I want to be more involved in this process because I believe in it. Collective bargaining strengthens public service. It helps us retain staff, preventative burnout, and create accountability. When workers feel respected and heard, we do our best work and the community benefits. Serving on a bargaining team has shown me the process and collectiveness and thoughtfulness in this about our conflict. It's about fairness. Every department, including public health and housing, deserves the best part of that. I respectfully ask you to support CDLE's ruling, oppose this motion, and stay, and ensure that public health and housing authority staff are included in this process without further delay. Thank you for your time.
Thank you.
Our last sign up for comment at the meeting is from Christina Edstrom.
Good evening, members of the board. My name is Christina Edstrom, and I work to reduce sugary drinks on the HEAL team at Boulder County Public Health. I'm also a proud member of the Boulder County Employees Union, affiliated with the Communication Workers of America. I'm here today to speak on behalf of myself and my coworkers who are part of the Boulder County workforce. I come from a long line of union members and leaders and believe strongly in the good that comes from employees having a voice at the table. We formed our union in a thoughtful, democratic manner, and the goal throughout it was to uplift the voices of all of us working in Boulder County, as we do work every day to serve our residents. I was disappointed to learn that a legal team was hired by Boulder County Public Health and the Housing Authority to file a motion to halt our collective bargaining process. This action not only disregards the democratic will of the workers, it's also a waste of taxpayer resources at a time when resources are tight and uncertain at this time of tumult. Not only that, but I feel that this legal strategy stands in conflict with the intent and spirit of COPCA. I respectfully ask you to reconsider this legal approach and instead choose to come to the table in good faith. I love my job and I love serving the community I grew up in. I want a union so that all of my Boulder County coworkers can feel the same fairness and satisfaction that I feel in my work. When workers feel heard and have a voice, we have a stronger workforce to serve the residents of Boulder County. Thank you so much for your time.
Thank you.
That concludes our public comment portion. Like I said, we did receive 5 written comments. Those have been shared with the Board of Health.
Great. Really appreciate all of you showing up tonight and sharing your comments with us. Thank you. So now I think we are moving into, I think I got to make a motion. I got the language here. I move to enter into executive session under Colorado Revised Statute Section 24-6-402 4B, to receive legal advice on specific legal questions regarding the continuation or potential stay of underlying agency action in the limited appeal of Boulder County, the Boulder County Housing Authority, and Boulder County Public Health and District Court of the Colorado Department of Labor and Employment's collective bargaining unit determination for Boulder County under the Collective Bargaining by County Employees Act. Second. Second. All right, all in favor? Aye. Aye.
Aye.
Okay, this is to move into executive session and that. Thank you very much. We are now going to move into executive session.
We're going to keep this meeting running, but the microphones will be muted. So you can stay online if you want. And the board's going to leave this room and they'll come back when we resume the public portion of the meeting.
Okay.
for a minute, guys.
Hey, Lindy, are you all done over there or? Lindy?
So I'm gonna wait for just a
Lindy?
I can't hear her. Can't hear. A bunch of people just joined. It's weird. Must be coming back. Yep.
Lindy, can you hear us or are you still having trouble hearing us? We can't hear you. Why can't we hear you? Should you be here? Sorry.
I'm spreading. Yeah, we can hear Landry.
Yeah, we heard Landry. Lindy, I think it's on, the sound might be on your end. Because we heard Landry.
Can you hear me now? Yes.
Okay. Great. Sorry about that.
Just one moment while we just double check that the recording's going. Okay, yeah, that's going. Okay, thank you. You're ready whenever the board's ready.
Okay, do I start this or you start this?
I will go ahead and start.
Okay.
So for the item on the agenda, requesting, board authorization. Let me start over. I'm Kate Hewitt. I'm an assistant county attorney with the Boulder County Attorney's Office. And I'm here today requesting that the Board of Health authorize the executive director to work with outside counsel to take the necessary steps to file a motion to stay bargaining between the Board of County Commissioners and Boulder County Public Health employees under the Collective Bargaining by County Employees Act, otherwise known as COPCA. As you know, this board previously authorized the filing of a complaint to appeal the determination of CDLE that found that public health employees are part of the bargaining unit for Boulder County. And the Board of County Commissioners are expected to soon begin negotiations with the employee union in the coming weeks. So while the court is deciding whether or not the bargaining unit properly or improperly includes public health employees, bargaining is expected to move forward between the county commissioners and the union. Our office is here today requesting authorization for the motion to stay because it is our office's opinion and the opinion of public health outside counsel that public health would suffer irreparable harm without a stay, specifically because of the resources that would be expended in participating in negotiations under COPCA without certainty as to whether or not those negotiations would apply to public health employees at all. So we would recommend, the legal advice for the board is to file this motion to stay bargaining. I will add that outside counsel did reach out to counsel for the union to see if the union would be interested in proceeding with bargaining without public health employees. And the union did not agree to that. So outside counsel did try to come up with a way for bargaining to proceed between the county commissioners and county employees without, the need for a motion to stay. And that offer was rejected, which leads us to this current recommendation. So with that said, I will turn it over to the board and I can answer any other questions that the board has during its discussion.
Thank you, Kate. I want to take a minute to clarify and reconfirm that the Board of Health is not against our employees organizing for collective bargaining, and we have not taken steps to prevent our employees from collective bargaining. We've maintained our position that BCPH is a separate entity from the county, and we want to maintain our autonomy over our own budget. And that continues to be my position. The question in front of us, as it's been articulated, is that whether or not bargaining should start while we're waiting for clarification from the court on whether BCPH employees should be included with Boulder County employees in the union, or whether or not they should have a separate organizing body. And we've been advised that it would risk more public dollars being wasted by starting negotiations and then to have the court decide BCPH employees are inappropriately included in those negotiations. We take our responsibility both for the well-being of our employees and for the stewardship of public resources very seriously. So that is weighing into my decision, my position to support the motion to stay until we hear a final decision from the court. That is my opening there, and I welcome other comments from board members.
This is Landry Fagan. I agree. Thank you, Morgan. I agree with your position, and I think it could complicate things if we are participating in negotiations that then are sidelined. It will actually create more work for all parties involved if that happens in the interim.
Hey, Morgan, this is Lindy. I appreciate your comments. I do not think that waiting on collective bargaining is going to create quote unquote irreparable harm in that interim period while we're waiting to hear from the courts. So if the estimated cost is $25,000 and some staff time, and the collective bargaining unit feels strongly, or the employees union feels strongly that they want to start, I do not believe that we could, in good faith, say that that would create irreparable harm, and therefore I think we should allow bargaining to continue.
This is Brooke, and I believe, so I echo everything that Morgan said, and I agree. It is very important, our Board of Health is set up by the state to be independent of the county commissioners for a reason. And especially at a time where we need to have maximum control of our budget, we don't want to start down a path where we could end up beholden to the county commissioners for our budgeting. And additionally, there is another option there's the proper option for unionizing under that should should Board of Health employees not, should it be decided that Board of Health employees, or sorry, Department of Health employees are not part of this collective bargaining unit? So I agree with what has been suggested by legal.
Yeah, I'll rapidly say I agree with both Brooke. Well, Brooke stated what I was going to say really well, which is that I appreciate, first of all, the opportunity to learn from public comment tonight. For those of you who came and shared your perspectives, I appreciate the opportunity to speak with legal and to speak with the leadership of the Public Health Department just to learn more. I agree that we have a unique setup in Boulder County with the county commissioners operating independently from the Board of Health. And I do think that it's in the best interest of the Public Health Department to have a seat at the table, a guaranteed seat at the table when we're bargaining. So for that reason, I also would vote that we pause bargaining until we get a determination from the court.
Okay, thank you to my fellow board members for their comments. I do want to echo Amber's appreciation for the public comments tonight. We really do appreciate hearing from you. It is meaningful, and we want to continue to hear from you. And now I want to get the language. So I will ask for, and I will make a motion for the Board of Health to direct the executive director to work with council to pursue a stay of underlying agency action pending resolution of the appeal of CDLE's collective bargaining unit determination for Boulder County under COPCA. A second, and then we will vote.
A second.
All in favor?
Aye.
Aye. All opposed? Lindy, were you opposed? Sorry, you're not on, you're on mute.
Yes, no, nay. I
Okay.
don't know what the right word is, but no.
Okay. Okay, thank you. Then the motion passes, and we'll continue the process from here.
Thank you.
Okay, thanks, everyone. Appreciate it.
Okay, now we'll move on to approval of the March 10 meeting minutes is our next topic.
Okay. For which we also need a motion.
Motion to
I
approve.
move that we pass the March 10th regular meeting minutes.
Now I will second.
Okay, great. All in favor?
Aye.
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 Okay, thank you. Item number 5, maternal child health programs, Boulder County Public Health.
Thank you. I'll just give you a quick intro, if that's okay. So this is part of our series of doing deep dives and highlighting staff work and maternal and child health. While it's not a strategic priority, it is an area of work in BCPH where we have a number of different programs that collaborate together. And we really wanted to be able to give you a little bit more information this evening about what that collection of work under maternal and child health looks like at BCPH. And I will turn it over to Daphne McDavid and Heather Bright.
Thank you. Thank you for inviting us to talk about these programs. And I serve as the Family Health Division Manager at Boulder County Public Health. And I'm Heather Crate, and I'm the Community Health Division Manager. And yes, there are various programs that provide home visiting to families with young children. And in front of you, there's a little handout here. We also sent some materials in advance, which you may or may not have had a chance to read. But just in case, we wanted to just kind of share that home visiting programs with children with families have a world of science behind them. And that was the main thing. We wanted to just root you in the fact that that science does exist, and that the materials that we sent you in advance are examples of some of the reports and some of the data that is available. We have reams and reams and reams of data available should you want them. But anyway, so before we get started, that's just an FYI. The main thing here is that within this cycle here, that that if you are supporting families, that you can reduce their sources of stress, you can strengthen the core life skills, and you can give them supportive relationships and help the growing child in the community. So it leads to a healthier community and healthier outcomes. So that's the main gist of this handout for those of you who aren't in the room. And with that, let's go to the next slide. We'll start at the state level. So the statewide MCH stands for Maternal Child Health. And in 2021, there was a home visiting investment task force. What we wanted to show here from the illustration is really, this is just a snapshot to show you that as a county-driven state there, every county has an array of home visiting programs. And this was back in 2021. And in here, you'll see both the Nurse Family Partnership is in green, and then Healthy Families America is gray. That's Genesis. And you'll see Boulder County there. We have a smattering. If you go down to Denver, you'll see there are 6 dots. And if you do the next slide there, the recommendations from the Home Visiting Investment Task Force back in 2021 had 20 different recommendations of 6 strategies. Of those, some of the highlights that we pulled out that we're doing here in Boulder County are increasing the capacity of programs by 20%. That was at a state level. We've been doing that we launched Family Connects, which is a home visiting service that is a short touch, not a longer program. We also expanded the NFP capacity. So these are just examples. There's many more. We also extended access across all programs to have more culturally and linguistically appropriate family services. We've expanded our bilingual nursing and our navigation staff across all programs. We supported universal early outreach at the local community level. And again, this is Family Connects and Find Help and many other spaces as well. We've also worked on building capacity of families to engage with their peers through the creation of the Family Voice Ambassadors. We've been working on building shared messaging strategies with the Community Norms campaign. And we've been exploring mental health and wellness activities within the home visiting programs through strategies like the infant and early childhood mental health consultants. This is all just to show you that our strategies are within a framework that's been recommended at the state level. So if you want to go to the next slide. Here is what we lovingly call our rainbow spreadsheet. This is the continuum of services in Boulder County, and 3 are housed within Boulder County Public Health, actually 4 now with the addition of Family Connects. So those are children with special needs, which is in the orange-ish color, and then in purple, Nurse Family Partnership, and then in kind of lavender, Healthy Families America, which is also known as Genesis, and then on the far right, Family Connects. On the continuum from the far left to the far right, kind of a deeper touch to a lighter touch. That's the way they're arranged. And with that, that's an overview of the programs here, and I'll pass it off to Heather.
You can go ahead and go to the next slide. As Daphne mentioned, that last one, thinking about lighter touches, our programs do tend to be more in the prevention space. We are hoping to have these early interventions often before children are born in that prenatal space to support families in order to really avoid a lot of system involvement, child welfare with other systems that many families and children become involved with. So we just wanted to highlight some of the specific populations that benefit from the services that we provide here. First-time parents, especially through Nurse Family Partnership, parents of children with special needs. We have a very specific program, and that program actually works all the way up through 21, I believe, for young people with special needs. Families who are facing financial stress, dealing with other health issues. We work a lot around housing, stable housing. In particular, teen parents with our Genesis program. That is something unique that we do here in Boulder County. And then with the addition of Family Connects, really all parents who are bringing a new baby into the home. And personally, as a foster and adoptive parent, that also includes foster and adoptive families, which is really lovely because many times there is no preparation time for that baby coming into the home. And specifically, there is a lot of evidence as we provided, if you've had a chance to look at that, just generally around MCH or maternal child health. So one of the main benefits and the benefits of having more than one program here is that families get to opt into whatever programming maybe fits best for them. It's more personalized based on their needs, and comes right to their home, which is the lovely part about all of our programs providing home visitation. Key benefits to our community, to our families, supporting healthy pregnancy and birth outcomes, promoting child development. Many of you were probably part of presentations around the LENA work that the Genesis program does, for example, around developing language for children, which is really cool, and just one example of many. We work hard to connect families to resources that we don't provide here in public health, that are available either in our community or beyond. And really, at the core of most of this is encouraging that positive parent-child interaction. We spend a lot of time focusing on that in our work. I'm not advancing slides. Can you advance the slide, please? I'm sorry, I'm looking at it. So that was super brief because we have very limited time. And again, we sent you some information ahead of time, but one of the main thing we just wanted to open up, what questions do you still have? Was there anything that you were looking at ahead of time or anything you've heard about our MCH work that we can help answer or provide information on?
Well, Amber and I had the pleasure of attending the celebration last week of the 1,000th home visitation, or home visit, I guess, through Family Connects. And that was really, really a nice thing. It's really special, yeah, to hear from some of the families who have benefited from the program, and gave me an opportunity to reflect on my own early parenting moments and how overwhelming it is, and how nice it would have been actually to have a professional come and visit and either confirm some of the things I'm doing or help with some of the advice. So it was thanks for including us in that. And I heard Commissioner Loachman was also there, and I heard her say, this is exactly the kind of upstream intervention that really can have a huge impact on disrupting cycles also. And so that was great to hear her support. And we think it's fabulous. So thanks for including us, and congrats on all that work. I don't think I have any questions, but
Thanks for coming. It meant a lot to have Jill there.
I might not have a question either, but she stole what I was going to say, which is that if I have the opportunity to brag about what BCPH does in terms of child health, I always take it. I think you guys do amazing work. I mean, I think your rainbow spreadsheet, as you like to call it, shows that you have it's not a one size fits all approach for families, right? And I think the fact that you're giving so many different, ways to meet family needs is very impressive. So proud of the work you're doing. Keep telling us how we can support it.
any other questions or comments by board members?
I'll just say that part of the reason we're really proud of this work is that we recognize that the United States doesn't do a great job of investing in this particular moment in people's lives, and being able to stand with the community in this space and say, we will help fill the gap to get you and your child off to a lifelong healthy start is really important for us. So thanks for your support for the programs.
Yeah. Thanks, Kathy and Heather.
If questions arise, you know where to reach us. So thank you. Appreciate y'all's support.
Next up, I lost track. Yeah, I lost track of the number in terms of items, but we're budget update.
Budget update. You don't have any slides, right, Armand?
No slides. Really, it's a small, just a quick update on priority-based budgeting. So I just want to take some time to give you a quick update on what's going on with priority-based budgeting. So last 2 months, right around February, March, we've been working with all the divisions and working hard on developing recommendations to align us with the 3 budget reduction targets, as you recall, that I brought to the retreat. Using the decision tree I'm pleased to say that we've actually, our divisions have actually submitted 130 recommendations. Out of the 130 recommendations, obviously, we have to vet them, making sure that there is, the financial impact. Some of them are process improvement, as we discussed. Others are looking at partnerships, but there was 130 recommendations by the division. So they did a great job looking at their own programs. And also, we've completed the new scorecard, or the scorecard has been finalized for both mandatory and non-mandatory. So we do have those. We ran some deviations, so the scorecards look very clean. And then what's next now is the director's team is actually working on reviewing the recommendations individually with each division, and we'll be completing that this week. And after that, we will be putting all those in a category and really looking at all those recommendations to say, is it budget neutral? Is it revenue generating? Is it moving forward for more further recommendation as analysis and more feasibility as far as funding? Or are we doing it, or is it process, or do we need additional information? And then ultimately, it's not feasible, right? So there's some of these recommendations that are just not feasible for public health. And overall, trying to just come up with using the feasibility tool next would be is to assess if it's moving forward to develop the 26 budget. So there's a lot of work. We've been putting a lot of hours in. We've been working with divisions, hopefully to draft a preliminary budget here end of May, early March. Any questions? Early June. Yeah.
Next quarter.
Yeah,
Next quarter. Yeah.
that's great to hear that so many recommendations came back. So it feels like those are good concrete things that are going to help us move in the direction we need to go. It's not a direction any of us want to go, except for creating better efficiencies, which is
absolutely.
Yeah.
Well, and our goal right now is just to be prepared for whatever comes at us. So the list is not a list of things that we're going to implement. It is a list of these are our options depending on what our budget situation looks like.
I appreciate that you're having like a bottom up approach to it as well, right? Allowing people to help coming up with all of those options.
Yeah.
Well, our divisions and our programs certainly know what's feasible better than we do. And they'll be prioritizing their own lists, and then we'll look at how do we put it all together.
Any other questions from board members online?
Nope.
No questions. Okay.
Thank
Thanks,
you.
Armando. Thanks, Lexi, for moving us forward on that process. I know it's a big lift.
And thanks to all of the staff who've been
Yes.
participating in this process.
Absolutely.
It has been a big lift, and y'all have done a great job.
Item number, I've lost track, but next is policy update. Item 7, legislative update.
Okay, I also do not have any slides. I'm really just gonna review kind of what I presented in the director's report and answer any questions that you all have. So CDPHE, I think you knew that they had issued a stop work order on 2 of our grants. That stop work order has been lifted, but we should be hearing, I thought it was today or tomorrow, about whether if the cessation of the grants can continue or not. We should hear shortly. The pattern that we've been seeing in the federal agencies is that the administration will make a decision about staffing cuts, and that will be followed by decisions about grants flowing to local governments or state or whoever. So we've been kind of continuing to track, especially HHS, CDC, EPA, Department of Agriculture, who are all some of our funders on this issue, just to make sure that we're keeping up with kind of the moment to moment changes that we're seeing happening. We are, in terms of a timeline, we are expecting the budget discussions to continue through the summer and perhaps into autumn, which is unfortunate, but that's the reality of where we are right now. So PBB is especially important for us to be able to kind of continue to apply changes based on kind of what we're seeing as the year evolves. And on the state side, we are, we may be seeing some declines in our Communities That Care grant related to the marijuana tax revenues, which have been declining. The word on the street is that those declines will impact grants by about 30%, a 30% cut, so it's significant, but it is one program in our repertoire.
The revenue's declining because people are buying less marijuana.
That's correct. So, yeah. The restaurant inspection fee increase bill is expected to be introduced this week. I think it's supposed to be introduced tomorrow, in fact. We do have someone from Calco who will be testifying on it, but this was a bill that was developed jointly between public health and the restaurant industry. So we are hoping that the legislature feels that it's something that they can support. It's been 6 years since there's been a fee increase, even though generally they try to do it on a triannual case. And it's been a while because of the COVID interruptions. This is an area of our work that desperately needs funding. Across the state, about half of restaurant inspectors are funded by counties. We continue to look at the reduction for the Governor's Family Connects grant. It seems to be steady at about 10%. There has been a lot of movement with the community health worker funding that was originally scheduled to begin in July. And then a bill was introduced to rescind that as part of the JBC's work, but then the Senate voted to keep the funding, and then the House voted not to keep the funding. And so now it's got to go back for reconciliation. What I think is heartening is that we have seen individual legislators' positions change on this issue as they learned more. And I think that this is, a lesson for us as public health to talk more frequently and earlier with our legislators, especially ones that influence funding, to make sure that they understand all of the consequences of the votes that they're making, and we're not kind of coming after the fact. So hopefully that will be, an important role for our new policy and systems change senior analyst to be responsible for, along with me. I do want to thank staff for helping with testimony and letter writing on the community health worker issues. Mary and Patrick were both really helpful in this space, and Heather as well. And then finally, just to let you know that BCPH staff provided input on written testimony that the county presented on HB 25-1309, which was protect access to gender affirming care. So we're hoping that the budget decisions wrap up in the next couple of weeks, and that by the time we come back to you in May, that we can really give you a full analysis of, or at least a high level analysis of what the decisions made with the legislature were for this session.
What's the last day of the session? It's in May, anybody, yeah?
It's early May.
May 7th.
7th, I was going to, 7th, I think.
Sarah's she's our wonk.
And
we'll have some.
There has been some session about whether there will be a special session this summer or not. It seems likely to me.
Yes.
The coordination between the feds and the state around how the pass-through monies that come through CDPHE and whether our federal monies that pass through CDPHE will be renewed for July 1st grants is a question still on the table. We're not clear how they're even going to know whether to issue new contracts or how long they'll be, or those kinds of issues. We are talking with our federal representatives and helping us to figure that out.
Thank you. As always, any questions? Okay, thanks for that. See? Okay, item number 8 is the director's report.
I really wanted to highlight that measles is beginning to pick up. We do have Stephanie Farron here. If you all have any questions, we saw 3 cases in Colorado in 8 days. So we are thinking about, you know, ramping the response work up. Issued a press release on behalf of NVPH, really asking people to join us and helping to make sure people are protected. And we're also talking internally. The team has been doing work to coordinate with the schools on response efforts. And we will also be talking about how do we make sure that, given kind of some of the reductions, especially in our FE team, how do we make sure that we have coverage if we start to see a surge in the space? And Stephanie's here.
I just
Do
want to
you
give
wanna-
a shout out and also say thank you because that team has been planning for over a month. And they have been through a lot and I feel very proud that this team is going to be able to manage local response. The other thing to point out is that our school district data is showing, from last year, is showing 95% vaccination for MMR for the K through 12 in both St. Vrain and for Boulder Valley. So I think where we maybe are a little bit nervous about is the under 5, but we're getting that data from the state just to see, who's kind of highest risk groups. Stephanie, do you want to talk about all the great work you all want me to?
Yeah, thanks. Yeah, thank you, Lexi and Indira. I wanted to mention just kind of where we are nationally. We're over 700 cases now as of today. And the 3 cases here in Colorado, the 1 case that we had recently around Wolf Creek area, there was no travel associated with that case. And so that's really kind of highlighting the need for us to really ramp up, that there's potentially some community transmission here going on. So the other thing that I wanted to mention was the case in Denver had over 200 contacts. Those contacts were spread across 69 different counties in Colorado. So, and outside of Colorado. So we really, see the increased workload even when the case isn't here. We have been following up on cases. We've had 4 rule out or suspect cases so far here. And thankfully, like we said, they've all ruled out. I wanted to mention, you mentioned, Indira, that our K-12 MMR rates are high across the whole county. There are some pockets where we have unvaccinated or unknown status, and we are following up with those. And our MMR requests are up from last year and at this time, and also from the past couple of months. So they're seeing folks coming in for MMRs, both in adults and kiddos. And they're receiving calls also around the vaccine and what to do and what to look out for. And then this Thursday, we have a tabletop exercise that we're going to be looking at kind of coordinated scenarios across hospitals, schools, CU, we have Clinica coming, as well as Weld and Broomfield, because of course our school districts, go across different counties as well. And our incident action plan is really ready. They're specific to an incident, so there's, holes in it for what we need to fill in if it happens. But the likelihood right now is pretty high that we'll start to see some additional cases here. Definitely in Colorado and potentially here as well.
Stephanie, you mentioned Clinica. Are we working with any other community-based partners, particularly in like harder to reach communities around vaccination and where you can get vaccinated for your kids, infants? Like I'm thinking about, El Centrio Amistad or El Comité getting information out.
We do have relationships with those agencies. We have a clinic coming up on the 3rd of May, the Cinco de Mayo event in Longmont, and we'll be hosting a clinic on that day on a Saturday. So that information is going out to our partners and the school districts as well. And then, you know, the harm reduction program works with outreach providers in Longmont and here in Boulder as well. And so really this information is getting disseminated through all of the channels.
Yeah, I'm just thinking about the, you know, the concerns of folks who might not be documented, who don't want to show up, right?
Yeah.
Here, so how do we ensure that they have access to vaccines?
Yeah. You know, we have opportunities for vaccine clinics. We're not seeing a drop off in Longmont of folks coming in. And Clinica and some of the other, you know, and Salute are also providing vaccinations as well. So
Are those free?
they are, yeah, they have the VFC program as well. Anything that you'd like to
No,
add?
I'm glad you called this out, though. It was impressive in the director's report. I mean, I think proactive, like calling the families of child, you know, who missed their first dose. I mean, we're districts increasing already vaccine rates. I mean, well done. I think this is a scary
They're
prospect.
working really hard. And the school districts are also reaching out to staff as well. They understand it was in 2019 when we kind of did all of this exercise, and I was in the school district then, kind of started us in preparing that it wouldn't just affect, you know, students, but staff wouldn't be able to come to work either if they didn't have their records. So they have started to ramp that up in the school districts as well. So it's really good planning that's being done here.
I mean, considering there's a generation of healthcare providers and public health people who haven't had
Never.
Yeah, right.
Yeah.
Anything you'd like to? Just shout out to Carol, who's done a lot of work in this space, Chris Campbell, Carrie, Keith, and their teams. There's a really good group of folks that huddle on a regular basis and have been really leaning into that space. So thank you all for your hard work on this.
Yeah, thank you. And it is really nice actually to be facing something that we do have a vaccine for, right? I mean, we have a very effective vaccine. We know, yeah, so the more we can get that information and access to folks.
Our child health promotion team has been leaning in with communications with child care providers.
Great.
Yeah.
And I would say, you know, there might be some access issues, but I think the immunization team has really built a solid reputation within the community as a place to go, because we don't check anybody's status or anything. You just come in and get your vaccine. So there's that. I would say, you know, the demographic of people who choose not to get vaccinated may be different than what we might see in other vaccine.
Yeah.
Yep.
Or other access to the public.
Yeah.
Yeah.
Thank you very much. Any other questions about the director's report? Favorite section. Item number 9, old new business. What do you got for me?
Nothing today.
Anyone?
I think we should shout out to those who completed their Board of Health training.
For that, yeah, Lindy and I represented. I know some of you actually, Amber, I feel like you always get yours done anyway, so it's not really fair to be recognized for actually doing what we were supposed to be doing every year, but.
And thank you for the feedback too on that and giving that to CDPH.
Yeah, you know, I think for Lindy and I, it inspired a desire to connect more with other boards of health because it was really interesting and helpful. And this is one opportunity to do so. I think that there are probably other more useful ways that we can connect with other boards of health members.
That's something that we can help with too.
Yeah, and I sent this to Patrick and Lexi afterwards, but who puts on that leadership thing that we went to that was on communication?
Oh, that was Judy did that one. With was it Rocky Mountain Training Center?
No, yeah, but it was under some other public health leadership program.
Yeah, the Right Health program.
Yeah, Right Health.
Yeah. Was it? Okay.
Yeah, so for those opportunities that come up, if there are others, that was totally worth the time.
Communications training.
Yeah, in terms of, it was both really helpful training, but also
really a nice opportunity to connect with other public health departments and board members and staffers and.
That's really helpful because we're going to be having our CALFO and CDPHE retreats on May 6th and 7th. And that's something concrete that I think might be interesting to bring back to them in terms of, and then I can talk with other directors about, is that something that your boards would enjoy? I do think it would be lovely if we could create more connectivity between the boards, especially, but not only boards that are separate from commissioners' bodies.
Yes, yes. And I've been thinking about that training with the measles cases, because it was all about how boards and staff also can communicate with the public in ways that are clear, in ways that are factual. And so it feels especially timely also looking at.
Yeah, and I think sorry, Morgan, to interrupt you, another
Please, go ahead.
important point that we talked about was, and Lexi, you've been talking about this as well, which is in a resource constrained environment, level of collaboration should be going up, right? And so that we're not duplicating things that we might be able to share across counties. So I think, yeah, it sort of resonated with me that these relationships, not just at the staff level, but also at the board level, can be quite helpful, I think, in terms of running a more efficient department. So yeah, it was great from that perspective.
Yeah.
You're making me excited to do the training.
Oh. I don't think I want to measure your excitement on this particular training, but I think.
Don't oversell it.
No, that's right. It inspired our desire to do more connecting. So that's the takeaway. Okay, item number 10. We're out of here. Adjourning. Thank you, everyone.
Thank you.
Thanks.
Bye, guys.
Thank you. Bye.
Thank you.
Bye.